advantages and the drawbacks of microscopy. There are no drawbacks, بس احنا هنفترض there are drawbacks to somebody who doesn't use microscopy. So the advantages طبعا number one is that you have a range of magnification. For loops not so much. يعني أنا متأكد loop users after about 4 or 5 months of use نفسهم يزودوا إيه؟ magnification, but they're stuck. They only buy one loops. You have it at 3.5x or 5x, and you can't go up or you can't go down. Okay, so but with a microscope you have the ability to go up on your magnification أو تنزل تحت حسب احتياجك. So if I'm doing I'm looking for an instrument fracture at the apex, I can go up to 18x. If I'm doing a crown preparation, I can go back to 6x بمزاجي. I'm sure, but big difference. Big difference. The second very important, or probably the most important advantage of magnification is shadowless light. And I'm sure كلنا we've had this experience. You're working in upper 7, occlusal distal cavity, big cheek, big tongue, دنيا very difficult, and you put your mirror, you bring your light at an angle, and you're looking in, and you're بتحاول تظبط الضوء على أساس تشوف within the cavity. So بتظبط إيدك takes you about a minute عقبال ما تظبط إيدك وابتديت تشوف إيه within the cavity, but you can only see the buccal side of the cavity. Okay, and then you shift your hand and you shed light into the lingual part. So now you can see the lingual part بس مش شايف الإيه الbuccal part. Okay, so انت عملت لها تباديل وتوفيق, and then you put your contra in front of it, and it shows even more shadow. So now you can't see it all, and after you give up تروح ضرب ضربتين look, ضرب ضربتين look. So you're working by chance. Okay, and this is because within the mouth you are creating shadow, and shadow is because your eyes are in one direction, your line of view, and the light is also at a different line of view, at an angle. So no matter مهما بتحاول تعمل, it will always end up there's going to be part of the canal or part of the cavity فيها ايه shadow. Now with magnification سواء بتستعمل loops أو microscope, الvision ماشي مع الضوء. يعني if you're with loops you have your headlamp here, the light is in the same line of vision as your eyes. So if you're looking into the cavity يا انت شايف وكل حاجة مضاءة يا انت مش شايف, but there is no option تبقى شايف وفي ايه ضي. The same thing with the objective lens of your microscope. Within the microscope you have your objective lens, your line of view, and you have light that comes from the line of view. So whenever I'm looking in the microscope you don't see any shadow. This is probably more important than the magnification. Parallel vision. الناس اللي بقى لها 10 سنين شغالة, how many cases can you do per day before you get a headache? كم حالة؟ 3, 4, 5. بعد كده you start getting headaches, then you have to take Brufen. Sure. Okay. This is one of the reasons is because of parallel vision. When you're observing without magnification or even with loops, you are looking at a point that's about 45 centimeters away from your face. يعني المسافة ما بيني وبين العيان أو بين سنة العيان حوالي 40-45 سنتي. فأنت دايما عينيك converging عشان تشوف النقطة اللي هي أمامك ب 45 degrees. That means your orbicularis or oculi and the adjunctive muscles of your eye are all under stress. Give it 4 or 5 hours of being under stress, you will also weaken your eyesight over time, ولكن also you will also get headaches. Okay, so but with this is the case with loops, and this is also the case with unaided vision. يعني حتى بالloops you will also get headaches because مهما كان you are still looking at a point in front of you. Now with a microscope you have something called parallel vision. الobjective lens بتاع الميكروسكوب بياخد الimage and it is split into 2 separate images, one for my right eye and one for my left eye. So when I look into the binoculars of my microscope, it's as if I'm looking into infinity. أنا مش باصص قدامي. So it's like the image جاي من بعيد. So my eyes are under no stress at all. As one of the big advantages of magnification فوق الميكروسكوب فوق loops. Your eyes are less stressed. Okay? Also مين بيشتغل كده؟ If you're not using magnification كلكم بتشتغلوا كده, because the automatic thing that happens immediately is that when I cannot see فبتروح مقرب, right? And when you're opening and you're doing the upper فبتروح عامل ايه? So give yourself a few hours of this, you get muscular pain, I'm sure that after about 10 years of practicing, كل يوم بتروح لازم تاخد لك some sort of brufen, يتعمل لك مساج, يتحط Voltaren cream, because simply you are stressing your muscles constantly. Now, the case is as well is less with loops. Yani in loops, you will probably be sitting like this, but if you notice, the doctor is also bending his neck. Yani even though you're using loops, your head has become a joint. So, because احنا واحنا بنقرا كتاب, مين اللي بيلبس نظاره؟ اوكي يا اوكي الناس اللي بتلبس نظاره احنا بنتعذب واحنا بننام بالليل وبنحاول نقرا كتاب. We cannot. انت تقدر تقعد كده وتبص كده. انا ما اقدرش اعمل كده. انا عشان ابص على الكتاب لازم اعمل ايه؟ So it stresses my neck. وانا نايم في السرير بالليل I cannot. Or I have to raise my hands up عشان اقعد اقرا بالليل. So I stress my arm muscles or my neck muscles عشان اعرف اقرا في السرير. Now we're very familiar with this الناس اللي بتلبس نظاره. بس الناس اللي بتشتغل من غير loops, they can look at their patient with their eyes and not with their neck. Okay? But once you use loops, غصب عنك بقيت انت focused here عشان تبص على المنطقة اللي تحت لازم تعمل ايه؟ So, although it does improve your neck, your back posture, it does not improve much your A. So even using loops over time will create neck pains. Not as much back pains, but still some neck pains. This is how I operate. Upper, lower, anterior, posterior, it doesn't make a difference. This is how I sit on my microscope. It's from 0 to 20 degrees, mostly 0 to 10. And it doesn't make a difference upper, lower, or anterior, or posterior. This is how I sit. I don't care how, what. And I can show you here. I've been using the microscope for so long because here I had black hair, and now I have white hair. So I've been using the microscope for a very long time. All right. So considering that I have less eye fatigue, less back and neck fatigue, I can work longer hours. Even at my age now, I'm not that old, ولكن 25 years into my career, I can work from 9 in the morning till 1, take a 2-hour break and work from 2 till 9. I can do a volume of 18 patients a day without feeling neck or back pain. Because now, even if you're using loops, 5 or 6 hours بعد كده انت هيجيبوك من على الارض. That's it. The reason is because I have less fatigue. هبقى تعبان طبعا because it's a lot of patients, but in general there was no way for me to do this. No way if I was using loops. No way. Okay, طبعا the image of being a microdentist is a very, very nice image. I'm sure anybody who's used a microscope will know. Anybody who has loops, برضو مهما كان العيان بيدخل بيلاقي كلاب loops, it looks very professional. And this means you can ask your patients for more fees. لا يستوي الأعمى والبصير, literally. Okay, so you have the ability to do this. احنا لما بنجيب أي جهاز جديد عندنا في العيادة, we put it in front of the patient. You get a new CAT cam, بترميها قدام الباتient. You get a new laser instrument, you're playing Star Wars in front of your patient. So you try and show your patient that you have extra pieces of equipment, you have up-to-date technology, and this way you can ask the patient for more money. ده طبيعي. Okay? Documentation and patient communication is very useful. I find it unbelievable. زمان لما I try to convince my pedo patients I'm going to do a filling and this filling is going to cost you 2400 جنيه ولا whatever 1400 جنيه. الأم والأب عمالين يلطموا ده سنة لبنية why مش عارف, even if they're educated. So in the end, when you show the patient's mom or dad this big D or E with blood coming out and caries and broken down, when you come to try and convince him of the line of treatment, it's very easy because he's seen it. غير لما تجيب له مراية بس شايف الضرس, هو شايف ايه, حتة ضرس صغيرة فيها نقطة سوداء, هو مش متخيل what a problem it is. So your ability to convince your patient of lines of treatment is well enhanced.